My name's Lynne Drummond. I work as a consultant psychiatrist specialising in OCD, body dysmorphic disorder and anxiety disorders. Anxiety is a universal experience. Everybody that lives on earth has had anxiety from time to time and in different situations. And there's usually two components to anxiety. There's the trait anxiety, which is the background level of anxiety, which can vary from individual to individual. So some people are naturally very anxious about lots of things, rather cautious people, and some people are much less anxious, much more laid back. Anxiety only becomes a problem if it is much more severe or frequent than the patient is used to or can tolerate. Symptoms of anxiety really can be split into two major components. That's physical and emotional symptoms. On the physical side, it can affect almost any part of the body and any system of the body. So the most common ones, of course, are shaking, sweating, feeling your heart pound, feeling difficulty in getting a breath or breathing very rapidly, muscle pains, headaches, feeling of tension, etc., etc. With the emotional symptoms, they're often a feeling of impending doom, a feeling of loss of control, a fear that you're going to go mad or do something inappropriate. Anxiety is a symptom, it's not a diagnosis in its own right. And so anxiety can accompany a whole range of psychological conditions, which can range from depression, phobic disorder, obsessive-compulsive disorders, and other psychological problems. I think the important thing is that it's recognised. The treatment of anxiety, there's really two strands. One is drug treatment and the other is psychological treatment. From the point of view of psychological treatment, these treatments are actually time limited and work on the basis of trying to work collaboratively with the sufferer. In terms of drug treatments, really drug treatments are not usually used for phobic disorder with the exception of social phobia. But in obsessive-compulsive disorder, we tend to use a group of drugs known as the serotonin reuptake inhibitors, or SRIs. And with those drugs, there is evidence that you may need to continue it for life, and that actually stopping the drug may cause relapse. For that reason, I think it's often a good idea to do the combination therapy, and then once you've done the psychological therapy, to try and tail off the drug, obviously looking for any sign of relapse. I mean, I think the most important thing that I'm always having to say to people is whether you've got a mild anxiety disorder or a very, very severe disorder, and no matter whether you've had it for 10 minutes or 40 years, actually anxiety is a very treatable condition and you can improve. And I think that's the message that I'd really like people to take on board, to understand and to come forward, because a lot of people suffer in silence for far, far, far too long.